My Health, My Knowledge, My Way. Introducing Leanne,
Rebecca,
Louise, Moya. Welcome to this podcast from the Doncaster Learning Disability Health Team for those living in and around the Doncaster area. As we know, people who have a learning disability have poorer health than the general public, and there is also a poor uptake for people who have a learning disability to attend cancer screening appointments. Today, we are going to look at the menopause. Some of us start it earlier than others, but as women, it is another progression through life. This is sometimes called the change of life, or it may be shortened to going through the change. What are the symptoms of the menopause or the perimenopause?
So symptoms might be hot flushes when you have a sudden feeling of hot or cold in your face, neck and chest, and this can make you feel dizzy. You might look a bit red around your area as well. There might be difficulty in going to sleep or trying to stay asleep all night, and you might get night sweats, which means you get really hot and sweaty overnight, and you might feel droplets of sweat on your neck or shoulders or back or your hairline. And this might make you feel tired and irritable during the day because you've not had enough sleep. Some people get palpitations, and this is when your heart beats suddenly and you can feel it making a little drumming noise inside your chest. People might get more headaches or suffer something called migraines, which are a certain type of headache, and these are worse than they've ever had before. Some people say their muscles ache or they get joint pain, so you might feel it in your hips or your knees. Some women say that they get a change in body shape and weight gain happens, and it's harder to lose, so some people might get a bit more what we'd call pear-shaped. Might be a bit big around your belly. There might be skin changes. You might get dry or itchy skin that you've not had before. And if you're sexually active, you might have less interest in having sex, and they call that a reduced sex drive. Sometimes this goes along with what we call vaginal dryness or pain, which might mean that when you have sex it's itchy or it's uncomfortable. And you might get an increase or more recurrent, happens more often, urinary tract infections. Moya, how long do these symptoms last?
Symptoms can last for months or years and can change with time. For example, hot flushes and night sweats may improve, and then you may develop low mood and anxiety. Some symptoms, such as joint pain and vaginal dryness, can carry on after your periods have actually stopped. Becky, what can you do to help?
So there are lots of things that we can do to help when we're going through this change or the menopause. One thing is that getting advice early can help reduce the impact of perimenopause, that is the time just before the menopause starts, or the menopause itself and the impact that has on your health, relationships and any work. There are some treatments that can help. It's not right for everybody, so you do need to chat to your doctor, but these could be something called HRT. Also, you might have heard it as hormone replacement therapy, and that's something that the doctor would prescribe if it's appropriate. Moya was talking about feeling low in your mood, and sometimes the doctor can give you tablets to improve your mood. And earlier I said some people struggle with sleep, and the doctor again can give you tablets to help you sleep. Or you could look at things like mindfulness or how to relax better. One of the things that we can all do that will keep us healthy in lots of ways, not just around the menopause, is having a good diet and a good exercise regime. So walking more, going to the gym, whatever exercise you like to do. Leanne, is there anything else that we can do to monitor this?
Well, did you know on our newsletter there is a checklist, and if you answer yes to most of these questions, you could contact your GP for some more advice about the menopause. And also, you need to be aware that you can still become pregnant if you have unprotected sex during the menopause, so that's something just to be aware of. You may still need to take your contraception medication or use contraception until your doctor says it is safe to stop using these.
Well, thanks for listening, everybody, and we hope you've now got some insight into the effects and symptoms of the menopause. Don't forget to take a look at that newsletter that accompanies this podcast, and it's got more information and that checklist on there. In our next podcast, we're going to talk about constipation. Yes, we've done poo before and we're going to do poo again. See you soon. Bye for now.
Bye.